So last week we told you about a procedure called image lift performed by Dr. Richard Castellano, which can take years off your appearance in as little as 90 minutes.
Well, we're going to introduce you to a patient who is very happy with her results. Meet Michael.
I chose Dr. Castellano because I had gone to 4 or 5 different doctors and sat with them and talked. He made me feel very comfortable. He was so genuine, made me feel comfortable, made me feel like he really cared about myself and what I was experiencing.
Everything's looking good.
Meet the new me in Thanksgiving.
So what was it that finally made you decide that you wanted to do it?
Oh, I just kept in the mirror and looking at my jowls. They were hanging farther and it made me look sad. And I'm a happy person. So I smiled, but I still had that turned down mouth.
Everything went very well. Could you feel anything during the procedure, any discomfort?
None whatsoever.
Okay. Awesome.
None.
Congratulations. You did great.
Great.
Okay.
It's exciting.
So check this out. If you want to see the entire procedure, at the entire video of the procedure, then you can go to YouTube, and we had a link there for you. We'll put it on our website, studio10.tv as well. And Michael is here now, and there was an immediate change after you had the procedure.
Yes.
Were you just blown away?
I was really surprised. I expected to be down for days. And I was up the next day at his office, and I had no pain.
And you caught just a little bit of it on that video, but Dr. Castellano was saying that you were just chattering all the way through the procedure. You were so relaxed. Had you ever been through a procedure where you were that relaxed and comfortable?
No. No, and I was afraid of that.
Dr. Castellano, what exactly did you do for Michael?
So we did the medium image lift for her, and this is just 2 weeks afterwards, and so you can see the difference in her neck and jowline, and it's very difficult to see the incision location if you look around the ear in the after picture, and that will continue to fade over time. So today Michael is 3 weeks, so you see her result now, and this is what people are looking for. They want to look natural, they want to look more youthful, they want to look like themselves. They don't want to look extreme, they don't want to look overdone, and that's why the image lift is so popular.
Michael, your jawline just looks unbelievable.
Yes.
Are you just, I mean, you must look in the mirror. Yeah, I bet you can't stop looking in the mirror lately.
I can, and I was blessed with those from my mother. They run in my family, so I was going to have them. But as I went through the years of the 50s, they just got worse and worse and worse. So I was excited. I just look in the mirror now, and my husband looks at me and he goes, "My gosh, it's such a change."
And this is amazing too, doctor, because you do this without, you don't do the IV anesthesia, you don't do general anesthesia. Yeah. How do you do it exactly?
It's just some relaxing medicine by mouth, and we do the numbing medicine like at the dentist's office. And because it's not a traditional facelift, you can do these procedures and patients don't really know what you're doing. And because it's less risk, less invasive, that's what patients are looking for. And Michael did very well. Some patients take longer to recover, some patients a little less, but for the procedure we did for Michael, it's not uncommon that they get back into the swing of things. She was back at work showing houses. She's one of the best realtors in town, and she's right back into the swing of things. And that's why people want to do these types of procedures.
You're going to have to take new business card pictures now.
I already did that.
First thing she did after the procedure.
You know, too, before we went on the air today, Michael was showing us the marks that were left, and they are so minuscule. It's unbelievable, easily covered up with makeup. And you were showing me where they were, and there are very few incision places anyway.
Right.
I mean, it just really looks fantastic, and you can't even see them here looking at her. So anybody you were talking to, or if you're doing business, they wouldn't even be able to tell.
No, and I had my eyelids done also. So he had done the eyelids, so I have, you know, I can say, I told my husband, now you're in trouble, I can see you over there.
So, what kind of reaction have you gotten from your husband and friends and family and clients and so forth?
It's funny you asked. I had a coming out party on the 3rd day because I had put makeup on and I had filmed it for Dr. Castellano. I had my neighbors come over, who some of them didn't even know, and they were just in shock, and they just couldn't believe that I looked so refreshed, and they were so excited for me.
Yeah, you can see the YouTube videos. Some of it's on there, so you can see that as well.
Yeah, it's pretty funny because they were surprised. They didn't know they were being filmed. So it was pretty fun to do that, and then I interviewed them and to see what they thought and how they felt about it.
So Michael, you had the, I believe, a medium lift done?
That's correct.
Now, what are the different levels, doctor?
So when we choose to do a lifting procedure, you're really making 2 important decisions. The first decision is obviously who your doctor is. Once you've made a decision on someone you trust, feel comfortable comfortable with them and seen their track record, you can choose either a small, a medium, or a large lift. I like to talk about it that way because I think it makes sense. A large lift is more like a traditional facelift, where you lift everything up from stem to stern, and theoretically you can get the most improvement with that, but also higher risk of looking unnatural, more expense, more recovery. Most patients don't want that. So you can choose the small or the medium. The small is like the 1 hour mini. Tightens in one direction like this, can soften here, improve here and here, but it's not for everyone. If you want more improvement than what the small can do, then the medium image lift is what you can do, and that's what Michael did, because it tightens here and it tightens underneath from 2 directions, so you get a better result on profile. So that's a general way of describing it. It's customized. There's no one size fits all, but in general, that's the medium is a very popular choice if you want to really improve what's under here and look very natural.